Sinus infection or sinusitis is the inflammation or swelling of air cavities in the passage of the nose. It is also known as the rhino-sinusitis, rhino meaning a nose, caused by infection or allergies in the nasal cavities. A sinus infection occurs when bacteria, fungus, and virus enters or grows within the sinus. The primary reason behind sinus infection is the allergy caused by the environmental pollen that irritates nasal passages. There are several types of sinus infections, such as acute bacterial sinusitis, chronic sinusitis, sub-acute sinusitis, and recurrent acute sinusitis. It can happen to anybody anytime in their life, but people suffering from nasal allergies, abnormal nose structure, weaker immune systems, and asthma are more prone to sinus infections. The sinus infection symptoms resemble the common cold, but the symptoms of common cold disappear after 3 to 5 days. Prolonged cold symptoms turn into sinusitis. Let us discuss the most predominant signs of sinus infection in detail that you should not ignore. Number 1. Headache. Headache is the primary indication of a sinus infection. Your head feels heavy and burdened, and symptoms get worse when you bend down. Number 2. Facial tenderness. You may also feel fullness or swelling in your face when you touch the part over the sinus, the area behind your eyebrows, cheekbones, and between your eyes. These symptoms can last for 12 weeks or more in acute sinusitis. Number 3. Redness around the eyes. Sinus infection is also indicated by the redness and swelling around the eyes. Sometimes the patient suffers from runny eyes and extreme pain. Number 4. Blurred vision. One of the most troublesome symptoms of sinus infection is trouble in the vision. The patient sees a double image and feels dizziness. Number 5. Sore throat. Sore throat is an inflammation of the throat tissues caused by the overproduction of mucus. The person suffers from acute sore throat and throbbing sensation around the neck. Number 6. Stiff neck. Another significant symptom of sinus infection is that the patient faces difficulty while rotating his neck. Number 7. Bad breath. Long-term sinus infection also leads to foul smell and bad breath. The bacterial infection is the primary reason for this symptom. Number 8. Dental pain. A common symptom of sinus infection that you must not ignore is dental pain. It is a tormenting situation for the person suffering from it. It occurs due to the increased pressure on adjacent nerves and tissues. Number 9. Fever. Sinus infection symptoms resemble the common cold, but the fever in sinus infection remains persistent, over 102 degrees in severe conditions. In this case, the patients should not ignore the symptoms and hurry to seek medical assistance. Number 10. Medication doesn't help. Symptoms of sinus infection prevail for a prolonged period and do not subdue with over-the-counter medicines. This condition is also worrying and requires appropriate medical checkups to treat the ailment. Number 11. Postnasal drip. Sinus infection overproduces mucus in the nasal cavity that flows down to your throat, irritating the tissues. Number 12. Cough. Sinus infection may end up in coughing to clear up the throat from the irritating phlegm. Number 13. Fatigue. The most common symptom of sinus infection is fatigue and low energy level. It may be due to a weaker immune system, fever, or pain caused by infection. Number 14. Recurrent multiple infections. Another perturbing situation that you should not ignore and must see a doctor is the reoccurrence of multiple infections over a prolonged period of time.
Anyways, let me know what you think about in the comment section below. I will see you all tomorrow. Don't forget to click the like button and share this video with your friends. Always stay tuned and subscribe to our channel by hitting the bell icon to see our latest videos. Thanks for joining us today.